Preventive interventions.
Preventive intervention applies to any activity with the objective of improving human health, preventing disease, curing, reducing existing diseases, and restoring functions lost through disease and injury.
One example of public preventive interventions is the implementation of vaccines.
There are stages to preventive interventions: primary, secondary, and tertiary.
Primary prevention are strategies and agents to prevent onset of disease, reverse or arrest before treatment.
Secondary prevention are routine methods to terminate the disease process or restore tissue.
Tertiary preventions would be strategies used to replace the tissues through rehabilitation.
Some examples of primary intervention are public fluoridation, mouth guards for athletes, and health education.
Some examples of secondary prevention are dental restorations, dental sealants, and periodontal debridement.
Some examples of tertiary interventions are prosthetics, dental implants, or oral maxillofacial surgery.
Recognizing and strategizing for interventions.
Assessments and evaluations are needed to know what type of prevention is necessary in individuals and/or target groups. These assessments, indices, and tools identify the presence and severity of infection and/or risk factors for infection.
Planning can be interprofessional.
Including the patient's primary care physician and other specialists create a well-rounded, individualized care plan.
Educate and explain why the prevention intervention is important.
Documentation is a critical factor.
Professionals and providers must be liable because it is a legal document.
Documentation helps evaluate progression.
Examples of documentation can be use of coding and clinical note documentation.
Documentation is our salvation.
It's not written in your notes, it didn't happen.
Have you been paying attention? Let's find out. Is this primary, secondary, or tertiary?
Fluoride use on incipient caries. While fluoride use can be an example of primary prevention, in this particular scenario for incipient caries, it is a secondary prevention method. The dental hygiene process of care goal is designed to prevent disease, identify existing disease, and create a care plan centered around stopping the progression and the rehabilitation. Thank you.
Gracias.
Goodbye.
Happy brushing.